Okay, we're back. We're live. What's today? Tuesday. Tuesday. And we're talking about health in Hawaii. Senator Josh Green is on travel. And so Ginny Pressler and I thought we'd do the show anyway. Okay, and that's Ginny Pressler. She's an MD. She's a surgeon, I think.
I was a surgeon.
And she's also, importantly now, the Executive Vice President and Chief Strategic Officer of Hawai'i Pacific Health. And if you didn't know, Hawai'i Pacific Health runs Kapiolani Hospital, my wife's very favorite.
Good.
Polimomi, Straub, and Wilcox Hospital on Kauai. And today we're going to talk about a number of things. We're going to start out with diabetes, so we're calling this episode the diabetes epidemic in Hawaii, but it actually goes beyond Hawaii.
Yes.
It's not a global thing. So welcome to the show, Ginny.
Thank you, Jay. Happy to be here. Have you here. I don't know that I can fill Josh's shoes, but I'll try.
or me.
Right.
Let me, before we get into the substance, I just want to mention that Ginny and I are working together on a program about technology in medicine, which is scheduled for August 27th, which is Wednesday, I think. And it's at the Laniakea YWCA downtown, and it's a luncheon panel program involving a number of doctors and scientists to tell us about what technologies are coming up, what technologies are emerging that might someday be helpful for us in dealing with healthcare. But not all of them are immediately appropriate, and we're going to make that distinction. So not only will you know what the technology is, you'll know whether it's soup for any given technology.
And whether we can pay for it or not.
That's a big part of it,
Right.
part of it. That'll be a very important program, because I think, that a lot of people, when they're well, they don't care about it. This pervades everything we talk about.
Yeah.
When they're well, they don't care about it. When they're sick, they find out they don't know enough to deal with it.
We take health for granted.
Yes, take health for granted and take medicine for granted. And I mean, we'll talk about this too. I mean, the modern 21st century view of it is you are at least in part responsible for your own health.
That's right.
And if you take that approach, you will have a happy and longer life.
Very true.
Anyway, so let's talk first about diabetes, Ginny. I mean, you hear so much about it. You look around about it. You hear stories of bad endings with diabetes. What is it, and how is it characterized and categorized for purposes of medicine?
Yeah, diabetes mellitus is a terrible disease, and there are two types. There's type 1, which we have historically called juvenile diabetes because it usually occurred in children, and that is an autoimmune disease that attacks the beta cells in the pancreas that produce insulin, and we need insulin circulating in our body to control our blood sugar levels in our blood. And so the type 1 diabetes is actually an absence of insulin, so there's no regulation of blood sugar, so people need to be on insulin in order to make up for that.
And that's constant, and that's for life.
Yes, that's for life. And well, there's lots of research technology going into trying to create artificial beta cells of the pancreas and pancreatic implants, transplants and things like that to treat diabetes. And then all kinds of external devices to do constant blood sugar measurements and try to control the insulin, like an artificial pancreas, basically.
And does a lot of people have this?
No, that's only about 5% of diabetes mellitus. The more common type, which is the one I want to talk about today because it's something we can do about, is the type 2 diabetes. This we used to call adult onset diabetes because it only happened as people got older and they got less active and got heavier and things like that. It represents about 95% of diabetes. This is the one that is preventable, and it is not an absence of insulin. It's because there's too much consumption, not enough physical activity, and too much consumption of sugary type beverages and foods and fatty foods, and even a lack of sleep that can cause increases in blood sugar, and it overwhelms the pancreas, so that the pancreas can't put out enough insulin. So that's a relative insufficiency of insulin as opposed to an absence of insulin. So it frequently doesn't need to be treated with insulin. It can be treated with other medications by mouth. But better yet, it can be prevented and frequently treated by getting people more physically active and having them be a little more cognizant of what it is they're eating and drinking. That can make a big difference in their health. And the reason diabetes is so scary is because the outcome, whether it be type 1 or type 2 diabetes, this high blood sugar in the bloodstream causes small vessel damage. And so people, the one you hear about the most is people having kidney failure and then having to be on dialysis, which is a terrible way to live.
Which is unnecessary.
It's preventable for type 2 diabetes, which is the majority of it. And it can cause blindness, it can cause strokes and heart attacks and amputations. Most of the amputations and some of those side effects we've reduced because we're managing the diabetes better. But it's a terrible thing to have diabetes and have to live with it and have it managed and trying to always be conscious of your blood sugar as opposed to preventing it by being a little more aware of how you can have a healthy lifestyle.
So what's the track of it? You know, it presents at first with a higher blood sugar, I guess, and a lower insulin in the blood, and then things go down from there. I mean, assuming it's not managed, right? And this happens, and
yes,
this happens.
We can actually identify pre-diabetes, which means people have a relative, sort of a higher blood sugar than they should, but it's not quite in the diabetic range. We know those people are high risk. We also have things, we see a lot of it at our Women's and Children's Hospital, is gestational diabetes when women are pregnant.
And
if
they
they're
eat
at risk,
everything under the sun.
well, because they put on extra weight and other hormone changes, they sometimes have diabetes just during their pregnancy, and then it goes away after they deliver. Those women are all at risk of getting full-blown diabetes later on. And so we're trying to be a lot more active in educating people, intervening early on when we know they're at risk. And so, because there is a genetic component to the type 2 diabetes. Some people are more susceptible than others, but
Well,
it's
yeah, I
mostly
wanted to ask you
preventable.
about that. So take an ordinary 25-year-old person, you know, who's gone through high school, college, who's been on a team or two, you know, who's done some swimming and hiking and all that. And he's now, or she is 25. And then we put him in a kind of experimental environment. And we'll feed him with every sugar, every carbohydrate we can find. We won't give him any exercise at all. Can we create diabetes too in somebody?
Absolutely. I just heard statistics today that just drinking in one additional 12-ounce sugary beverage a day increases your risk of getting type 2 diabetes by 25%. So even someone who is active, if they drink lots and lots of sugary beverages, they are putting themselves at serious risk of developing type 2 diabetes.
So can you be skinny and diabetic?
Yes, you can.
Can you be fat and not diabetic?
You can, but you increase your risk. The obesity trends we have in Hawaii, because you know diabetes is a global epidemic, and nationally it's a much more serious than it is in Hawaii. We seem to have a little better statistics, but we still have a serious problem. And we've had diabetes has more than doubled in the last 20 years in Hawaii, even though we're better than most of the nation. And the same trend at the same time has been the obesity rates that have paralleled that. They've both gone up in parallel, and obesity is a major cause of type 2 diabetes.
Yeah, let's see if we can get a shot of that. Show this
You can
chart.
see that.
So this demonstrates
So
the
that's-
relationship of one with the other.
Right, right. And the scary trend over the last 20 years has just been increasing in both.
And it has a secondary effect in the sense that all these side effect things happen to you if you're diabetic, which means, you know, you may not be able to work. You have all these economic results. I don't know how much of these side effects are covered by health insurance, maybe not everything.
It affects productivity at
Yeah.
work, so that it costs more. And, people that have diabetes tend to cost their employers about twice, it costs about twice as much in medical costs, but they also have a productivity factor because there's more absenteeism. And people with diabetes, on average, die about 10 years younger than their colleagues.
Because of these complications.
Yes, right. It's not something just to say, oh, gee, I mean, it's scary when I hear people sort of assume, well, it's inevitable when I get older, I'm going to get diabetes. That's not true. For type 2 diabetes, it is very much almost entirely preventable.
Well, let me throw my layman's suspicions at you. We live in the 21st century. We are surrounded with sugar. Everything has sugar. Everything has carbohydrates. Our society, through television ads and the like, encourages us to have sugary drinks and carbohydrate-laden food, and we're led to believe that this is all. If it really gets to be a problem, we can correct it and take you back to square one, as if it never happened in the first place. And I don't think I think the 21st century is indeed laden with fast foods, and fast foods are synonymous, or at least they well include the carbohydrates and sugar that will give you diabetes, even if you're perfectly otherwise healthy.
That's right. That's right.
And when you pass a certain threshold, I don't know what the metric is, but when you pass a certain threshold, it's not reversible. Am I right?
Yes, we have caused irreparable damage to the health of I would say 2 generations in America because of the kinds of food and because we've engineered activity out of our daily lives. So it's both. It's the consumption of food and drinks that increase the risk, as well as not getting enough physical activity. And for someone who is pre-diabetic, just reducing their body weight by about 5% and becoming physically active, so you have more muscle mass, which manages decreases your risk instead of more adipose tissue, fat tissue, makes a huge difference and can take you back from pre-diabetic or early diabetic to being not diabetic.
Okay, so a minor program, a program that that will help most people, would be to keep the sugary drinks away, not to focus on bread and other carbohydrates as much as protein type of foods or produce type of foods.
Right.
It would be to take a walk up the stairs, instead of taking the elevator for one flight.
Exactly.
And everybody out there who talks about the environment and sustainability, and how wonderful it is to live in Hawaii and see the mountains and the sky. How about actually taking a walk?
Yeah, take the stairs instead of the elevator. Walk a little further, and don't take the car. And ride your bicycle, walk. Just stay active. Doesn't matter. And if you're at work and you're at a desk, stand up, walk around your office. Read things while you're walking. Whatever you have to do to stay active. Don't just sit all day long, because that's not good for the body.
Not good for the mind either. I mean,
Yeah.
I've come to the conclusion. I do a lot of editing of video, and I know my editing is better when I stand up every hour, just for a minute, for 5 or 10 minutes, do anything else. And then I can free my mind up from what I was doing and go
There's
back to
very
it.
good scientific data now showing that our mind works better when we're physically active. So when we're working out, when we're walking, our mind I find that when I'm working out, I solve all the world's problems. Everything's simple.
There are limits, though. I got a short story. I knew a lawyer who used to go walking every Sunday morning, and he would take with him his timesheets. But you can't do that.
Yeah, and reading things while you're walking can create problems. You don't want to fall or get hit by a car.
Yeah, really.
You got to stay.
That's another problem.
Yeah, so that's why we have to address other issues like environment and all to create safe walking communities and all.
Okay, but the beginning is, this is something you can avoid, and you can avoid it completely. I mean, most people can avoid it completely. So isn't that wonderful to completely subtract the whole idea of diabetes out of your life by taking a few simple steps? That's a wonderful possibility.
Yep.
And get out of the sort of the shadow side of the 21st century.
We can't prevent all of it, but we could prevent most of it.
Yeah, good lesson. So that's Ginny Pressler. She's Executive Vice President and Chief Strategy Officer of Kapiolani,
Polymomy, Straub, and Wilcox hospitals, and all of our clinics. And
Hawai'i Pacific Health. Is that okay?
Correct, but most people don't know what that is. So.
Okay, you should know. And we're talking about healthcare in Hawaii. We're talking about the diabetes epidemic in Hawaii. And now that we've touched on that, we're going to take a short break. We're going to come back and talk about other aspects of the problem and other things that you can do to improve your health and the health of your family. We'll be right back.
Hello, I'm Martin Despang, and I'm the host together with the one and only Ali Yamashita, and our show is called Urban Transcendence. And urban transcendence is about identifying where we have a unique situation of a vibrant city in one of the most beautiful natural environments. So how these two can coincide, sometimes conflict, how they could find reciprocity in the 21st century is what we're excited about. And we're planning on bringing in a diverse body of guests, both from the arts and the science and the established and the wise and the emerging generation. So hope you will join us. We'll always be on Thursdays from 1 to 2 p.m. Thank you.
I'm Jay Fidell. We're back here on a Tuesday talking about healthcare in Hawaii with Ginny Pressler, Executive Vice President and Chief Strategic Officer of Hawai'i Pacific Health, which runs Kapilani, Palimomi, Straub, and Wilcox hospitals in Hawaii. And we have been talking about the diabetes epidemic in Hawaii, but now we're going to turn to other things that are similar and, in fact, related. Let's see where to begin. We should talk about the drivers of health in Hawaii.
Yeah.
It's not just diet, it's other things too.
Right, diabetes as well as other diseases. And the Institute of Medicine estimates that the total drivers of health, meaning both medical and physical and mental well-being, that only about 20% of it is actually related to medical care. We all expect medicine to bail us out and save us. We can do whatever we want, and then we go into the doctor or the emergency room and say, fix me. We do an amazing job of that in Hawaii and in the United States. We have the best health care in the world. However, we also pay for it because of that. And a lot of this is unnecessary, and we can't always fix everything. So if you really look at the total determinants of health, it's estimated only about 20% is actually due to medical care. If you don't have it, that's serious, but we can't fix everything. About 30% is estimated to be related to healthy behaviors, such as what you eat and drink, how much you sleep. We underestimate how important sleep is, a good night's sleep. And also how active you are, whether you smoke or not. All of those things represent about 30% of one's health, according to the Institute of Medicine. And then another 40% is felt to be social and economic. So if you don't have a roof over your head, if you don't know where you're going to get your next meal, if you don't know how you're going to pay the rent next month, all of those, and if you don't have a good social network so that you have socialization, if you're isolated, or for whatever reason, that represents about 40% of one's wellness.
That's the single largest driver.
Right. And those are the things where we can make policy changes to impact. So we have an opportunity both as citizens as well as working with the government for policy changes and things. And then about 10% is estimated to be related to the physical environment, clean water, clean air. Places like China, where the pollution in the air is dangerously high on most days, that takes a huge impact on one's health. It can cause lung cancer, heart disease, all kinds of problems with the body. I mean, when you think about what you're breathing and putting into your body.
Sure. So can we attack each one of those, at least each one of the non-medical things and medical care things? Healthy behaviors. That means what you eat. And, I remember that, Mayor Blumberg in New York had a big campaign against, sugary drinks. And he actually got an ordinance passed in New York.
There's a lot of pushback. People don't want to be told what to do.
Yeah. And I mean, that's a real interesting ethical conundrum. You say, okay, we're not going to tell you what to do, but would you please listen, because this is for your own good? And they go right back to the sugary drinks,
Right.
and they buy, and the companies selling the sugary drinks are advertising, like crazy. And so what do we do? Because in the end, the failure of the individual to live in a healthful way becomes the burden of the community. I mean, we don't have socialized medicine. In Europe, it almost feels like everyone is responsible for everyone. You know, it's a very kindly.
And people do get a lot more physical activity. They walk more. They ride bicycles. They take mass transit.
Yeah.
They're not driving cars as much
Yeah.
as we do in the United States.
So we have to begin thinking like that.
Right.
You know, and we're so driven. You know, this is a very competitive, driven society, and it really counts that you're ahead of the game. And so you wind up dropping off these healthy behaviors, and then you eat in fast food joints, and
Right.
and the result
Well,
is
and we have created that ourselves.
Yes.
I mean, 20 years ago, we didn't, well, even 20 years ago, we were starting to have an obesity epidemic. But it was, you know, it's doubled since then. So we have created this nightmare in our communities, in our society, by allowing ourselves to take the easy way out. We're busy, so we get fast food. The sugar and the fat taste good, so we eat it. We've engineered physical activity out of our lives. We take the elevator, we drive, we even use remote controls at home so we don't have to get up to change the channel on the TV. I mean, whatever we can do to minimize our motion has been engineered into our lives, and we've allowed that to happen. So I think it's incumbent upon us that are aware of how serious these issues are now and what the real drivers are, to try to educate the public. Now, we can't force people to do things,
No.
but if we can educate them, that doesn't mean they're going to change their behavior, because once someone is smoking, for instance, they become addicted, and it is, as much as they might wish
predictable.
to stop smoking, they know it's going to kill them. It's very, very difficult for them to stop, because nicotine is one of the most addictive substances there is. And same thing with getting used to drinking the sugary drinks and the processed foods, and the ease of it, the taste of it. We get used to it.
the
and
supermarket is filled with it.
Yeah,
and
and
the
we
fast
know
food
we know we shouldn't eat that chocolate, or well, chocolate's not bad for you, dark chocolate, but
the sugar.
we shouldn't be eating the donuts and the pastries and the hamburgers with a lot of fatty buns and things like that. But we do, because it's very difficult to change our behaviors.
To go to the ethical question, again, I keep thinking of that as you describe this thing. So make me king. Better yet, make you queen. We can both be king and queen. And we can say, we want our population, our subjects, to be as healthy as possible, because if they do that, we have the most efficient economy, because they are able to work, and we don't have the burden of taking care of people who didn't take care of themselves. And so what kind of edicts will we put out? We would say no sugary drinks, like Blumberg. No sugary drinks, and you must get up in the morning and do Tai Chi for at least half an hour.
Well, some countries do that.
Yes. And gee whiz, I mean, and the supermarket cannot carry X products because they're all sugar. And
we can't feed our kids sugary drinks and hamburgers and hot dogs and French fries.
It's not permitted. It's
Right.
against the law, or maybe you could tax. There's some kind of disincentive for doing that.
Right.
And we could establish. I mean, it would be unconstitutional, I'm sure.
Yes, yes.
But we could establish rules that would actually make the community healthier, lots healthier, and live longer, and less of a burden on the common good, the common obligation to take care of them. And I know that democracy wouldn't permit that.
That's right.
In this great nation of ours, you are free to kill yourself by bad, healthy behaviors.
Tobacco is a good example. It took us 70 years to really raise the common awareness that smoking is really bad for you. And we still have people smoking. But it took 70 years for us to really have a general understanding and knowledge that, yes, this is not good for you.
I was responsible for cutting out the smoking in a lot of the downtown buildings.
Were you?
My firm represented the buildings, and they came to us and said, "Can we do this?" And we said, "Watch." we actually achieved this result over time. And there were threats of lawsuits by people who really wanted to smoke. They had a right to smoke and so forth, and they didn't prevail, and they mostly swallowed on that. But the point is that people still feel in this country that they're entitled to do that kind of thing. And to take your example of the smoking, and move it into the sugar, you know, in 20, 30 years' time, we will find, and we already know this, that sugar is really bad for you, really, really bad for you, like tobacco. It may not be cancer, but it's all kinds of dreaded,
Well, it
fearful
increases cancer
things.
too. I mean, the thing that we don't realize when we talk about obesity and lack of physical activity, these things not only contribute to diabetes, but then heart disease and strokes, but also cancer. It increases, not all cancers, but there are a number of cancers that increase risk by being obese and the kind of lack of physical colon cancer, for instance. People who aren't physically active are at a higher risk of, and same with breast cancer. And there are other cancers that are very closely related to obesity.
So maybe, you know, the king and queen could say, or the legislature could say at some point, you remember tobacco? We outlawed it in this place and that, and it sticks. That's a legal outlaw. I mean, it wasn't upset. It is the law. Maybe we should do that with sugar. That public restaurants will not put sugar on the table. That sugary drinks won't have sugar. They'll have something else, and so forth. I mean, I'm attacking it broadly, but there may be, you know, specific things that can be done that would reduce the public health effect. And although we don't see them now because people say, I have a right, I have a right.
Right.
Maybe later it'll change.
We could mandate these things, which would never be accepted, as you said. But even if we did, there are issues related to economics. Somebody, you know, is losing out if you take away that industry, or that, you know, someone's going to lose, and even though our health will benefit, there'll be others who will be losing economically. And those who don't have the resources to be able to buy healthy food, it costs more than the fast foods to go and get healthy, fresh vegetables. And you have to have the refrigerator to put them in, and you have to have a clean kitchen to cook in, and it's very complicated. It's not as simple as we'd like it to be.
Well, you know, it comes down to having a local food industry, having that food industry prepare produce and protein that is healthy,
Certainly.
and make people understand.
And
they're
in
better
Hawaii,
off.
we should be able to be self-sufficient. We have the best air and water in the world, and we have a great environment for being physically active 365 days. Even when it's pouring rain, my husband and I get out and walk in the rain. We love it. We skip in the rain.
Oh, that's great.
So, you know, there's no reason not to be active in Hawaii.
Yeah, should be.
And-
Should encourage it.
And water is really very good for us.
That water's better than Diet Coke.
Yes,
you know.
yes, even better than Diet Coke. Yes.
So I guess the other thing that flows out of that is, as you said, it costs more money to be healthy, but it also costs more money for health care if you're not healthy. And I wonder, and the economic effect on the potato chip manufacturers. Oh, they'd be all hoo-hoo if you took potato chips off the market, even though it would be really good for everybody.
Right.
And they would fight back in some way. You have a chart.
Well, this goes back to our drivers of health. I mean, this showed it in a pie chart, which is probably an easy way to see, where I was talking about the 20% of drivers of health is medical services, and 40% socioeconomic, 10% environment, and 30% behavioral health. But if you look at where the money goes, you know, that 20% of medical represents 88% of the money that we spend on health and wellness. And we only spend 4% on the healthy behaviors. So, you know, it's not a very good use of our money, as I see it.
No, and we should not be sympathetic to people who say, "Oh, I'm not willing to spend more money on healthy behaviors."
That's right.
That's really backward. Yeah. Well, I'm wondering about the hospitals themselves, though. If I say, in the current model, potato chip manufacturers are making a lot of potato chips, and a lot of people are getting unhealthy over it, and they're going to the hospitals. So if I say no more potato chips, everybody has to, eat organic foods, whatever it is, then what? Nobody goes to the hospitals?
Yeah.
How do you feel about that?
Actually, that's a very good question, Jay, because that's exactly where hospitals are now. You know, in the past, we were all in the sickness business, and we depend upon people being sick and filling up our hospital beds. We still have those fixed costs, but all of the hospitals in Hawaii are focusing now much more on trying to help people stay healthy and stay out of their emergency rooms and out of their hospitals. Now we have to find ways to make that all cost effective so that we get compensated in some way for helping to keep the community healthy. Otherwise, this can never happen. All the hospitals will close, and then we don't have it because
And
we're
they don't have
always
healthcare.
going to need hospitals. We're always going to
Yes.
have accidents and trauma and heart attacks and things, even if we're very, very healthy.
Yeah.
And cancer, we need to have the hospitals. But we are all working very actively in working with the government and the community agencies and identifying the major areas where we can make an impact to try to create healthier lifestyles for people so that we can actually keep them out of our emergency rooms and our hospitals.
Yeah, that's a great idea in the thought that, and I think I've heard you talk about this before. We've had programs at the Plaza Club and so forth, where it seems to me that, and this is aside from all the changes in Washington, this is not part of that, or maybe it is, but I mean, it happens by itself as far as I can see, and that is that hospitals and the healthcare industry are focusing more these days, not as a matter of well, maybe it's a matter of economics, maybe it's the futuristic look that you described, but it's also a kind of human thing to try to help the community stay healthy.
Well, we're community partners. If we care about the communities we serve, we want to now help people be healthy as opposed to fixing them when they're sick.
Yeah.
Because once they're sick, sometimes it's irreparable, it's very costly, and it creates chronic diseases for people. So they can't have a happy, if you're not healthy, it's hard to be happy and feel good.
Yeah, and it's totally inefficient on a societal level.
Right, right.
So it seems to me that the big question then is, well, what do you do in this sort of pre-hospital activity? Because we want to keep you out. So it's education, it's training, it's outreach of one kind or another, or in-reach where they actually come in and participate in it. If I was king, maybe you would, as queen, you'd do the same thing. I'd make them come in every now and then. I'd sit them down and say, like in school, all right, this is what you need to know about this, that, and the other thing, and we're checking on you, and they're going to give you a test, and you're going to get a grade.
Well, in a perfect world, we create a healthy environment. So we have a healthy city that they call complete streets, which our mayor is very supportive of, as is our governor, so that we have safe walking paths, safe bicycling paths. They're working on a bike share program now, which would be protected from the roadway, so you're not, crossing over with cars. It's protected. In Europe, they have wonderful biking paths that are totally separate from. You can go all over the place in Germany and in Holland, and it's just so wonderful to be able to ride a bicycle and not worry about getting hit by a car. And so you can create a physical environment that helps people be active, and you can create, for instance, on Lanai, I'll give you an example. When Larry Ellison cares about the community there, so he bought the local grocery store, and he has now that he owns it, he can stock it the way he wishes, and so he is putting more local produce available to people. And grocery stores, if they want to be part of this major effort to create wellness in our communities, can help us all by putting just like we have tobacco behind a closed door now, we'll put the candy and the chips and the other stuff behind the closed doors too, and you have to ask for it. Don't put it out there in the checkout stand so the kids are screaming, "I want this, Mommy," as they're trying to check out.
Sure, seen that.
Yeah, so there's things called the blue zones now, which where communities are embracing this and saying, I want to create a healthy community. And so you can have blue zone checkout lines where parents can choose to go out that checkout line where there won't be candy in the checkout counter or something, but they still be there for those who want it. We're not telling anybody they can't have it. We're not telling them what to do. We're giving choices and options and working at the same time on educating at all levels, starting prenatal, pregnancy, postnatal, preschool, kindergarten, all the way through, so that it permeates our society, because what we've allowed to happen is to have the negative factors permeate our society because they've been lucrative for some people and they're killing us all.
Yeah, that we got to stop that.
Yeah.
And what's interesting about the model you described about the blue line, was it?
Yeah.
You know, what I like about that is it's not only that it adds a barrier of sorts, but it makes a statement. It says, you know, there's a difference between good food and bad food. And you know, we won't stop you from getting bad food, but we want to remind you every time you come in here that there's a difference. And we're sending you a message, and the government and the owners and the management, we're all sending you a message. Keep it on your mind.
If we really cared about people, we would have discounted or free fruits and vegetables and healthy foods, and just say, come, you don't take it. And then if you want to have soda or French fries or something else like that, you pay, and you pay more than it costs. And we put a big, you know, make it, to create the incentives so that it's people start over time doing what's better for them. But that would be a government takeover, and so that would never pass.
Right. If the government could say, well, the government could theoretically say we're going to add a potato chip tax, but people would squawk about that. It would never pass the legislature.
Right.
But if the individual grocery store owner, like Larry Ellison, says, I'm going to add a potato chip tax, I'm going to add 20% on that bag of potato chips, that would work.
That's right.
You know, and he wouldn't get rich over that, but people would get the message.
And you know, I just read this morning that there are a number of fast food industries that they're not advertising this, but they are voluntarily reducing the amount of sodium and fat and sugar in their products. They're not making a big deal about it. They're just gradually doing that so that our taste buds will change over time, and the public won't really notice if you reduce the salt by a little bit, but it sure is going to help our health.
Sure.
And over time, because right now, if they do that, they're afraid that, well, the competitor next door will give lots of sodium and sugar, and people will go there because they like the taste, and so they think they're getting a better deal, and that's what they want. Well, but it's hurting them.
I was going to ask you about it. Isn't it true that sugar is actually habit forming?
Yes.
And that the more sugar you have, the more sugar you want.
Right.
This is very deadly.
And our bodies are programmed to like sugar. I mean, that was a survival back when we lived in the wild. We crave sugar.
It gave us extra strength and so forth.
But when it's easily accessible and we can be eating sugar all day long, it's counterproductive. It's hurting us.
Yeah. Okay, let's take a short break, and we'll come back and we'll talk some more about the social and economic one that you listed, and maybe the physical environment, and we'll go on to community efforts and what the community's obligation and leverage is about this. And ultimately, the point of all, and that is personal responsibility.
Personal responsibility, yeah.
That's Ginny Pressler. She's Executive Vice President and Chief Strategic Officer of Hawai'i Pacific Health, which runs Kapiolani, Palimomi, Straub, and Wilcox hospitals in Hawaii. We're talking about healthcare in Hawaii. And we're talking, we started off with the diabetes epidemic, but we're going to other things which are really important. We'll be right back after the short break. I'm Jay Fidell. That's Sharon Moriwaki of the Hawaii Energy Policy Forum. And every Wednesday we have Hawaii, the State of Clean Energy. We've been doing it for some time now, and we have some fantastic guests on there, unbelievable guests who give us insight into what is going on in a very complex, sometimes very confusing, sometimes very disappointing area of progress in the state. So we love doing this. We love meeting them. We love talking to them. We love having their ideas out on the table. So maybe, just maybe, we can all make some sense of what's going on. Sharon, what do you think?
I think that's absolutely correct. We enjoy ourselves meeting with all these people and hearing about the energy and the state of clean energy, and hopefully we advance clean energy for the state. So it's terrific. Join us.
Okay, it's every Wednesday. Okay, Wednesday is Energy Day. Every Wednesday, 4 to 5 p.m. Hawaii, the State of Clean Energy, here on ThinkTech Hawaii. We'll see you there. Okay, we're back. We're live. We're here on a given Tuesday with Ginny Pressler. She's the Executive Vice President and Chief Strategic Officer of Hawai'i Pacific Health, which runs Kapiolani Hospital, Palimomi Hospital, Straub Hospital, and Wilcox Hospital in Hawaii. And this is healthcare in Hawaii. So I wanted to pursue the discussion of these two elements that you wrote on the list here of the drivers of health, which maybe people, are not fully aware of. And one of them, I think, by virtue of the 40% effect that you described, is the most important of all, and that's social and economic effects on health. And it reminds me of something which I think we all know, is that people who live in family, who are married with spouse or boyfriend, girlfriend, whatever it is, are likely to be more healthy
That's right.
than people who live alone. What's the process? Why is that?
Yeah. Well, there are many aspects to wellness. It not only has to do with what we eat and drink and how much activity we get, whether we smoke or not, but it depends on how much sleep we get, how stressed we are. And, we are social creatures. And not only are we meant to be physically active, and our bodies would really like to have healthier food and drink than we put in it normally, but we also are social creatures who thrive on social interaction. So isolation is not good for us. It creates body stresses, and people who are socially engaged and have other close family and friends live longer and live healthier. It's a very important part of overall health and well-being.
Yeah. So when you have a fight with your spouse, and you threaten to throw your spouse out of the house, better think twice.
It depends on the spouse.
It's just fact and circumstance, of course.
You got to be married to the right person.
But marry well.
Yes, that's right. That's right.
But the point is that being with your spouse is really important. Spending quality time, having social interaction will make you and your spouse a healthier person. That was the way it was designed way back when.
Yeah. Well, and they've even shown in the workplace that people, if you have places for people to, talk to each other and aggregate, have coffee breaks, they're more productive.
Yeah.
So we need that. We thrive on social interaction.
Happiness thing.
Yes, yes. Happiness is important for our health.
And it also, if we are engaging with people, we are not just intellectual disembodied brains trying to do intellectual disembodied brain things. We are more aware of our physical consciousness, and that helps.
We're more likely to care about our health
Yes.
if we're happy and
Yes.
want to be healthy.
So, but you associate that with economic considerations. And people who are in a higher economic strata are likely to be more healthy. Is this true?
Generally, that's true, and I think it's due to a number of things. If you are worried, constantly worried about the economics, how are you going to pay bills? Are you going to have a roof over your head? How are you going to send your kids to college? That's an added stress that takes a real toll on the body. That increases the stress hormones, the cortisol, and those stress factors increase your diabetes risk too. It raises your blood sugar. So there's a lot to be said for, you have to have that economic security. That's part of the overall health and wellness that's necessary in a society.
But it isn't just the economic security, isn't it also that you have to have an absence of stress? And even
Well, not a total stress is good for us to a certain extent.
Yes.
We need that stress so that we continue to improve and strive and try to fix things. A certain amount of stress is good. It
The human
stimulates us,
condition, yeah.
and that's what keeps us from getting demented if we stay actively engaged.
Yes.
And so we're stressed to a certain extent, but not the negative stress that just wears you down over time. And when you can't do anything about it, that's the negative stresses. And if you can't rise above the economics that are pulling you down.
So, but if you find that you are stressed out for whatever reason, then you have to do something for your own mental health.
Right.
Because a lack of mental health is going to affect other
That's right.
health
That's
issues
right.
for you.
That's right. And on the economic side, the major driver there to help people get out of the poor financial situation is education. So when we talk about health and wellness, we're not just talking about the medical care, as we said, which is only about 20% of that overall wellness. We're talking about education so that people can have meaningful, stimulating jobs that they enjoy and that pay them well enough so that they can afford basic necessities at least. And the happiest people are those that, not the really rich or the really poor, but those who make enough, sort of the middle class, that aren't worried about where am I going to get that next dime to pay the bills. But they don't have so much that they're worried about how am I going to manage these finances and what's going to happen to the market. And,
Right. and they're going to do what they like doing.
Right.
If you like doing, that somehow that affects all of this formula.
Right, right.
So, the
And
people
all of
who
that
run,
affects our health.
People who run video studios, for example, they like doing what they do.
Yeah, if you enjoy what you're doing, that's very important. Yeah.
So let's talk about the physical environment. You mentioned
Mm-hmm.
that briefly. It's about clean air and clean water. This may be affected by climate change and by changes on the planet over
Yes.
which we have, even though we are conscious of it here in Hawaii, we may not have all that much
Mm-hmm.
control.
And it's also is how we do community development, city planning. What they call the what are they calling it? The transit-related development, which I know
TOD,
there's
transit-oriented
we've been told
development.
there's a better term for that, not to use that term, but the fundamental of that is that use that opportunity to create healthy communities where people can walk and bicycle to get to the transit and not be stressed driving into town and stuck in traffic for an hour and a half. Get on the rail and be able to read a book or talk to somebody and not worry about what the traffic's doing and get some work done so that when you get to work you're ready to go.
Yeah. Well, this, I guess, I would ask you then. We are in a bit of a tipping point right now because we're educating ourselves. We're learning about kaka'ako. We're learning how you make a new modern community that everybody presumably likes.
And if we
we're
don't
learning
create
about-
enough open space and outdoor space for people to enjoy the sunshine and the healthy air and to socialize with each other and be physically active, what a shame that will be if we create a concrete jungle instead of creating a well-planned, development that allows for that open space.
I think what I hear you saying, and this is important to our show, is that the government ought to build in this kind of thinking in everything it does. Part of doing good governance is to having a happy electorate and a happy population and a healthy population.
Right.
So it's not just consciousness of the individual, it's consciousness of the body politic.
Right. And high-rise development can be very enjoyable and healthy if you have an opportunity to get out of your closed apartment and out interacting with other people and walking down, breathing this wonderful fresh air and being able to walk to theaters and get your groceries and not have to get in a car and drive and pollute the air.
So this kind of enjoyment of your daily life.
Yeah,
and
we have a great
engagement.
opportunity right
Yeah.
now to.
We can do this. We
Yeah.
can build this in. So, I mean, when you mention community efforts, is this what you're talking about,
Yeah,
Ginny?
this is part of it. It's our whole environment and our communities, yes, and the education, which all impacts our economics.
Okay. And the last and the final one is personal responsibility. And I heard you talk about that.
That's a tough one.
That's a tough one. But I mean, it's the general notion, and it's really, it's not something I grew up with. I grew up with the notion is anything goes wrong, go see the doctor, and I've come to find through my primary physician that it ain't like that at all, and that I really have to educate myself, and I have to listen to him, and I have to change my pattern of life, and if I don't do that, I'm like wasting years.
Well, we had a medical system for many years that I would describe as paternalistic, where it's like, don't worry, dear, we'll take care of you. Just, come in when you're sick and we'll fix it, and we'll take care of it. Just trust us. Well, we now are trying to do a better job of educating people as not just patients, but as consumers. They don't have to be sick to see us. We want them to be understanding the things that they can do to improve their own health, both mental as well as physical. That's a critical, 40% of the admissions to the emergency room are related to mental health problems. And so there's a major effort throughout the state now for us to focus more on that aspect, which has been ignored and compartmentalized out from the rest of medical care. That needs to be integrated and embedded into, we recognize the impact of that. But the personal responsibility, it's something you and I can understand. I've always been held accountable all my life. That was what was expected of me from my parents. And I embrace that, and I like being accountable and responsible. I need information and access to the tools I need to be able to do that. So that's one of the things we're trying to do with patients now throughout healthcare, throughout the state. For everybody's doing that. get the information to the patient, let them know what their blood pressure is, what their blood sugar is, are they at risk for this? What can they do to change those things and be partners in their care with us? So it's not the traditional medical model, it's more of a health and wellness partnership. And you've got patient educators and outreach workers and many other members of a team so that people can be more engaged in their health care.
Two-way street.
Yeah, and the engagement piece, that's the tough part, because people who are pretty happy, socially engaged, and care about their health are going to want to take care of themselves. They're going to stop smoking, they're going to be more active, they're going to do the things they need to do. Those who have mental health problems, who maybe can't get beyond that to focus on tomorrow, they're just trying to get through the day. Those who are drug addicts or don't have a roof over their head, who don't, they're just trying to get through the day. Single parents with, major problems, they smoke to
Get through the day.
To get through the day. And so to blame them for not stopping smoking is almost not fair. We need to recognize those, so when we talk about personal responsibility, it's easy to say, and for those of us who have the wherewithal, shame on us if we don't take personal responsibility. But we're going to have to take extra effort to get to those that need extra help. Just like kids in school, some need more help than others, and we need to provide that extra help to those in the community that need that wraparound support to pull them out of the trenches and have them care about living till tomorrow. So therefore, well, maybe I should take care of myself because I want to be around.
What a lovely notion that is, though, that the community is responsible. We are all, as members of the community,
That's right.
responsible. And I really appreciate that. So what about the one last question? We're really out of time, but I'm going to throw one last question at you. A few years ago, I think it was HMSA, started to get serious about the internet. And you could call your doctor on the internet, or a doctor, and get advice. I don't know if it's gone that far. I think maybe the medical community doesn't really like it that much. But do you see a future in that sort of thing?
Oh yes, we're going there. We're not there yet, but ultimately we will need to have it 24/7, 365 days a year. That if you have a healthcare problem, you can be in touch electronically or on the phone with a healthcare provider right then when you need it, so that you're not going to the emergency room for things that could be taken care of outside of, on an outpatient basis because you couldn't have access. Access to care in a timely manner is one of the major reasons why we have overuse of emergency rooms today.
Yeah.
So we're all working very productively on trying to improve access, whether it be having patients see their primary care doctors or specialists in a timely manner, or answering their questions in the middle of the night, making sure they have the information they need to take better care of themselves. So,
If I had to
it's
pick
happening.
one word, to sort of capsulize that, I would pick the word empowerment.
Yes.
Because it means that I have multiple options. I'm never really alone. I can always reach out. Somebody will always be there for me, even at 3 o'clock in the morning when my sword hurts.
Right.
And
Right.
and it's wonderful to have that, because if I'm so empowered, then I truly can conceive of myself as a partner
Right.
with the healthcare system, and we can work together.
Right.
Thank you, Ginny Pressler.
Thank you, Jay.
That's Ginny Pressler, Executive Vice President of Hawai'i Pacific Health, and the Chief Strategic Officer there. They run Kapiolani Hospital, Palimomi Hospital, Straub Hospital, and Wilcox Hospital. That makes them the biggest in the state. So this is Healthcare in Hawaii. We talked about many things beyond the diabetes epidemic, but that's okay. We'll do it again, right?
Yes.
Thank you so
Thank
much,
you, Jay.
Ginny.
It's a pleasure. Aloha.